Is avoiding spinal surgery actually even possible? Hey everyone, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. And I'm coming to you this week with a huge topic. We can literally 100% change people's lives here with what I'm about to share with you. Very, very important. And I want you to take a second after this video. I want you to think about it. Then I want you to help me out here. I want you to share this information with your friends and your family. There are people right on the cliff, right on the edge, and I want you to help me pull them back from the ledge, okay? Now listen, these days we are bombarded with constant marketing messages. It's a competition for our eyes and our ears, and it's nonstop. It's TV, radio, internet, email, video like this, in your mailbox, at home, and on and on and on. It is literally everywhere we look. It's to the point now where we just don't trust much of what we're being told anymore. And that's understandable. If you're anything like me, then you watch a commercial only if it entertains you or makes you laugh. But otherwise, you're hitting that fast forward button on the DVR, or you're tuning out until the show comes back on. Very understandable. Some marketing pieces are useless. Okay. A lot of marketing pieces are useless. But let's just be honest here. Some are amazing, and some provide real value that might even change your life for the better. I'll tell you a quick story to demonstrate what I'm talking about. I was being marketed one time by a guy at a conference. It was a few years ago, and when I went to the conference, honestly, I usually cruise right past the vendors in the exhibit hall. Most business conferences have a big exhibit hall full of vendors. Again, I usually just cruise right past them. I don't like person-to-person, face-to-face marketing. It's like a forced, awkward conversation, and I tend to do my best to avoid those when I can. For some reason, though, I gave him about 30 seconds, and he changed my life. He told me about some software he invented, and he was there promoting, and that this software, it actually fit my practice perfectly in the way I practice. He showed me how everything having to do with the software was backed by research papers. Well, I'm all about research papers and them backing my profession, so I was sold fairly quickly. Then he told me about a course that he was teaching at that very same conference, and that course could be applied toward a fellowship training certification in orthopedics. Before I met this guy, I wasn't planning on having any new software, and I certainly wasn't planning on getting any fellowship training in orthopedics. None of that was on my plate or my radar screen at all. I was and am a busy guy. I don't have extra time to be doing all that learning. I just don't have time. Yet, here I sit 3 years after that encounter, still very happily using his software, and I'm a year and a half beyond having gotten my orthopedic fellowship specialty certification. So my point here is that not all marketing is bad, and sometimes it can change your entire life if you learn to stop and listen to the stuff that resonates a little bit with you. Now that brings me to the topic of this article, a topic that is indeed a life-changing issue, and that is surgery. Nobody ever wants to have surgery, right? I don't believe I've ever met anyone that woke up and thought to themselves one day, you know, I've really been meaning to go out and get me some of that surgery business. I've heard some really good things about that surgery, and it's on sale this month down at the surgery store. I think today's the day. Of course not. We all know that some surgeries are absolutely necessary, while others may not be as necessary as we are commonly led to believe. Now think about it a minute. What if there were surgeries out there that you thought were necessary, but they really aren't? What if the surgeries you thought were absolutely necessary were not only not necessary, but also they weren't very well backed up in the research literature? And not only that, but they had never been tested against the idea of what happens when you don't have the surgery at all. Those two never compared, surgery versus no surgery. On top of it all, many times these surgeries are held up as being absolute and you cannot go on without them. Well, basically, they're carried out, they're handed to you as a foregone conclusion. You're just going to get surgery. There's no avoiding it. Might as well get it now. Patients are scared into these surgeries many times, and few, if any, real options or alternatives are ever discussed or offered to the patients with regard to avoiding the surgery altogether. It's scary, and many surgeons don't go out of their way, not even 1 inch, to dampen that anxiety or to help calm fears. People make irrational decisions when they're scared and they're desperate. And there are most certainly some surgeons that are counting on that to absolutely be the case. Now, if I were a spinal surgery patient, this would all very much upset me, and I would guess it would do the same to you as well. Not to mention your parents. If this were being done to your parents, I mean, it's upsetting. It would most certainly be upsetting if you actually knew that there were other options and they weren't offered to you. And unfortunately, most patients do not know that there are other options many times. Now, let me interject something just for a second here. And that's the fact that I am in no way against surgery when absolutely necessary. When all other options have been tried and failed, and it's the last resort, thank God for surgery and very smart and capable surgeons. Now, with that being said, though, the fact remains, there are surgeons out there ready to railroad patients into very unnecessary spinal surgeries that do not typically have adequate research and testing supporting them. Let me be fair, though. I know a couple of fairly conservative surgeons as well, and they really do try to avoid surgery. This is more aimed at the ones that do not understand or aren't aware of new guidelines and research, and they simply go straight to the operating room with their patients. This is who I'm talking to. I'm talking to you patients as well. Now, what do the experts say? Okay, in this day and age, there is no longer any dispute. I don't care who you've talked to. There's no longer any dispute. I'm a research nerd, and I'm telling you, safe and non-invasive care from alternative practitioners not only can help prevent surgeries, but it's now recommended by the medical profession's heaviest hitters. The medical profession, it's not a chiropractor telling you this stuff. The American College of Physicians and the American Family Physicians, two of the largest medical organizations in America, both now recommend non-invasive, non-pharmaceutical interventions as first-line therapies. Do these things before you do anything else. Specifically for long and short-term back pain, recommendations to try first before anything else are as follows. Spinal manipulation. Chiropractors do that. Exercise. Chiropractors do that, as well as PTs. There's massage or soft tissue work, which massage therapists and chiropractors do that. There's low-level laser. Chiropractors do that. And then there's acupuncture, also, of course done by acupuncturists, but also done by chiropractors. There's yoga, tai chi, heat, and cognitive behavioral therapy. It's my observation that when you go through this list, that the largest and most influential medical entities out there are telling you to go to a chiropractor. Not only because research has proven these therapies to be effective, but because chiropractors are preventing unnecessary, dangerous, not sufficiently backed in the research, and potentially life-altering spinal surgeries every single day, folks. This right now, this right here, this isn't marketing. It's the simple truth. And you've got to know it, and your people have to know it. Many disc injuries heal, and chiropractors can make the healing process tolerable and can typically speed it up. It is very common to treat a disc injury that has literally incapacitated a patient. They can't hardly walk or function or sit and stand. It's common to treat these people and then see that very same patient return to the clinic in just one day, and they are more than 50% improved in just one visit. It truly hurts me somewhere down inside, and I lose sleep sometimes when I hear of a person that has spinal surgery without having ever tried any alternative treatment first. I'm not kidding. Mostly because I know that they're not told there may be alternatives to that surgery, that the surgery hasn't likely been tested against not having it at all, and that they were most likely railroaded or scared into it. We want to think and we want to believe our doctors, the ones in the white jackets and all, we want to believe that our doctors and surgeons and caregivers are the smartest of the smart, the kindest of the kind, and only have our best interest at heart. And some absolutely, most certainly do. Some of them, if not most of them, they absolutely check all of those boxes. There are some amazing people in the medical profession. I've seen it, I've been around it, and a lot of times it is truly impressive. However, we're not all created equally upon this earth, folks. Some are egomaniacs, and they wouldn't think twice that they might need to change the way they do things or the way they look at things. Some have a private jet they need to pay for. Some have a house in the Caribbean that probably needs some repairs. And some should have retired 10 years ago. They're done. I have had patients tell me that their surgeons have told them things like this, quote, "It's not a question of if you have surgery, it's a question of when." So basically it's a foregone conclusion, right? Might as well just give up now and sign on that dotted line and let's get going, right? Another quote I heard, "If you don't get surgery, you'll eventually be in a wheelchair." Woo, that's not emotional manipulation, is it? And another one, "If we don't get this fixed, you could wind up paralyzed. The damage, permanent." Emotional manipulation, scaring, and railroading patients. Now, some of these surgeons just wanted compliance out of the patient, and they said things that would ensure that compliance. It would ensure getting them to sign up for that surgery and just move on, let's go. But maybe some of these surgeons actually believed these things. Now, if that's true, then that would make them extremely ignorant of most of the newer research and recommendations coming from their own profession. One of the most important concepts this language ignores is that words matter and play a big part in the biopsychosocial aspect of pain and the recovery from pain. The next thing they are ignoring by using this kind of language with their patients is that doctors cannot diagnose from an image. More and more research these days, it makes it very clear that you cannot cut out pain. And by identifying issues with the spine on an MRI and then going in to remove that issue, a doctor is treating from the image. What the newer recommendations tell us is that we must treat the patient sitting right in front of us, not an image. Mostly because we know that 60% of 40 to 50-year-olds have, and they've got zero pain at all. If we get them an MRI just for research purposes, no other reason, they're not hurting. 60% of 40 to 50-year-olds are going to have herniated discs, degenerated discs, facet hypertrophy, and all kinds of really big words that I'm not going to bore you with. But 60%, zero pain, well over half. The percentage only goes up the older we get. Closer to 100% of 70 to 80-year-olds have age-related findings that cause them no pain at all and no issue at all because it's normal. So if a surgeon finds something on an MRI and goes to cut it out, there's a solid chance that whatever they found may not even be the problem. It may just be normal for that patient and for that patient's age. Another newer concept being ignored too often is that pain is not usually a reason for surgery. Now, long-lasting, unending, life-changing pain, yeah, that may be a reason. But in general, pain is not a reason to have spinal surgery, especially for those already suffering from chronic pain syndrome. And that's defined by the National Pain Strategy as experiencing pain at least every other day for 6 months or more. That's chronic pain syndrome. And research suggests that if a patient in chronic pain syndrome has surgery on something, and the surgery goes absolutely perfectly, beautifully, everything is just as it was meant to be, then the patient will still have a 60% chance of developing chronic pain at the new site of injury. So when is it okay for spinal surgery? Well, it's typically more acceptable when a patient is having a change in bowel or bladder function, Cauda-Equina syndrome, or a neurological deficit. A neurological deficit is something like a decrease in sensation from one side to the other, or a decrease in your reflexes from one side to the other, or in a decrease in motor function, such as some sort of significant muscle weakness. Lastly, what I want to talk about here is surgeons using the kind of dangerous language we're talking about here. They are ignoring the recommendations that I mentioned before, that were set forth by their own medical entities, American College of Physicians, American Family Physicians, not to mention the Lancet Medical Journal. There was a great article in Journal of American Medical Association, the White House report on opioids abuse, all of these, the FDA, CDC, all of these big government and medical entities, they're now saying safe, non-invasive, non-pharmaceutical, non-surgical treatment first. If those treatments fail, then go to medications. If those treatments fail, then go to heavier, harder medications. And if those fail, then potentially steroid shots. If those fail, then, and only then, consider surgery. We don't flip it upside down and do surgery first. Not in this day and age, not anymore. We know too much, and now we're better than that. Sometimes surgery works out, and sometimes it doesn't. We see both sides of that every single day, every week. There is research showing many spinal surgeries are failures, and many have to be repeated, not just once, but twice and 3 times. It can be a slippery slope, folks. It's not reversible, and that's not a chance I'm willing to take from me, my family, or my patients. And I'm telling you now, without any marketing involved here, just me talking to you, most spinal surgeries can be avoided. And I can probably help you avoid them if you give it a chance, and if you let us try using spinal manipulative therapy, exercise, massage, low-level laser, disc decompression, acupuncture, and things like at-home pain management strategies. These are all things that we can leverage to help you avoid surgery. Now, the deal I make with my patients is give me 3 visits per week for 2 weeks. That's 6 visits for 2 weeks. If you are seeing improvement at that point, stick with it. And let's have some real fun watching you make progress towards getting back to your life, toward getting on the floor and playing with your kids or your grandkids, for getting some exercise that you weren't able to get. And it'll be a lot of fun to watch. If we can't get you moving in the right direction in just a couple of weeks, well, then we either need to change what we're doing with you, or I may not be your guy, and I can help you find somebody that hopefully is your person, that hopefully can help you. Now, when a patient is staring straight at a recommendation for having spinal surgery, well, that's just about as fair and as easy and honest and responsible of a deal as it gets, folks. If you've tried chiropractic before and it didn't help, that doesn't mean that chiropractic won't help you. More than likely, what it means is that you just didn't go to the right chiropractor. So try us out for a couple of weeks. Let's see if we can change your life for years to come. 2 weeks to try to change your life for years? That's a pretty good deal. The odds, the research, and the medical recommendations are all stacked in our favor. So honestly, what do you have to lose? What do you have to lose other than your pain, of course? Listen, you have to share this with your people. We have to help people get the right kind of care first, and I can't do that without your help. If you're watching on YouTube, subscribe and share. If you're watching on Facebook, like and share. Let's change the way things are done together. If you're from the Amarillo, Texas area, or you're going to be traveling through here and you need to be treated by an orthopedic neuromusculoskeletal specialist, give us a call, 806-355-3000. Let's get you on our schedule. Again, I'm Dr. Jeff Williams at Creekstone Integrated Care right here in Amarillo, Texas. We'll see you next week.